So, Ashley, when you think about what you thought of beauty early in your life versus now, tell me a little bit about how that's evolved
That's
and
wild.
perceptions
Yeah,
of
that's
you. Yeah.
such an interesting question. I think that things that we focus on when we're young and then as we age or as we have, other things in our lives like families and kids, it really does change. I mean, I think that the little things that I focused on when I was young were just so small. And then real life happens
Mm.
and you have I think more confidence and like a sense of self, and then you focus on things that are really important. It
I,
it
I
is different.
I would completely agree. So, like, one of the things I was thinking about in regards to this podcast is we're kind of talking about, you know, what beauty means to people as they move through their life.
Yeah.
And just kind of reflecting on that myself, I would agree. The 20s feels like it was this really great time to explore, identify with what
Yeah.
speaks to you. I think it's a time to have fun. I mean,
Mhm.
I don't know, how does that fit in your aesthetic kind of practice?
Yeah, I mean, you definitely see it's about values, right? And you definitely see that those values are different when you see women of every stage of life. And we do. We see really young women long before they want to actually have plastic surgery. They're here for more procedures, more skincare, maintenance, preventative type of thing. And that's amazing. And we see a lot more of that now because that's just so popular. Beauty is so popular in popular culture. And their priorities and values are really different than my patients who are just having their families. And that looks totally different. There's selflessness in a whole nother way. And then people really reclaiming themselves and their own identity after families and kids and approaching menopause and what that means for their identity and their relationships. It's just so different at every stage, and the cool thing is we see them at
Yeah.
every stage, so we get to see that little mix of it every day.
Yeah, I think the thing that's been interesting to me is as I kind of get to know my patients and I partner with them, it really does feel like patients don't want sometimes a solution at this point. I
Yes.
think they are open to understanding, like, what is what does my future look like? What does my path look like? And that's something we get to design together in terms of, like, what's the priority in this decade? How do
Yes.
I get ready for the next decade?
Yeah.
What can set me up? I think that is a big shift in how we have approached aesthetics.
Yeah, and young people are ready for it. Like, I think we have an older generation who maybe didn't do anything for a very long time, and then they were like, "Oh my goodness, what do I need to do to get where I wanna be?" And in these younger generations, you actually see them thinking forward and doing things a preventative way,
Yeah.
and, I think that we're gonna watch this younger generation age in a really beautiful way that we love
Yeah.
because we love to take care of them, you know, little bits. I think it's not about these big dynamic changes. It's about maintenance and that like lifelong process of, doing what you need to do to support yourself and age gracefully at every
So
stage.
take me through, like, your 20s and 30s. What are you advising your patients to focus on?
I think preventative at that point. I mean, at that point, they don't have a lot of wrinkles. Usually, they have great skin quality. And we're really looking at the longevity of their skin on their face, on their bodies. So, sometimes preventative Botox, definitely good skincare, good sun protection, support for their breasts, and, wearing a bra. And if their skin is not ideal, and there's some people who genetically are not, we're definitely able to intervene at that time. So we do a lot of breast surgery in the 20s. And the other group I think that we see at that time period is people who've lost a lot of weight. So people who have had medical weight
Yeah.
loss in those age brackets, they don't want to spend their best 20s and 30s with all this extra skin. And that's so cool because they don't have to. So we can certainly do surgeries to correct some of the extra skin that they have even long before they have a baby, and that's okay, and there's ways to do that really safely.
You said something in their 20s and 30s. I think that it's about, like, doing their best or living their best at that stage of their life. It's funny because I'd like to think, as I move through the years, I think the next decade's gonna be the best, right? That's what
Yeah.
we all think.
Yeah.
But truthfully, as you think about, like, what makes the 20s and 30s, like, memorable, it is a lot of, like, this idea of, like, I find in my patients identifying self, identifying what
Yeah.
speaks to you. I think it's about, for me, preserving in their face and in their like overall aesthetic this really beautiful, intangible, it's almost like ephemeral quality that youth brings.
Yeah.
And so I find myself telling patients, look, we can have fun, we can do things. Sometimes we make big changes. I can't tell you how many patients are doing rhinoplasty and neck
Yeah.
contouring in their 20s and 30s, but I will say that everything is going to be a for sure positive movement
Mhm.
forward as opposed to something that feels a little subjective that we may not agree was the best move. I want
Yeah.
everything to be something that you can build upon as
Yes.
you move through.
Yeah, you don't wanna burn any bridges. You wanna be able to continue to grow and do all these things as they go down. I think that that's true. We're constantly thinking about what's next and making sure that if we wanna do something a little bit different in the future, we're not hindering ourselves
Yeah.
in our ability
Yeah.
to do more at every stage.
Yeah, and it should, like you said, it should build upon it. I always tell my patients, if you're just getting to sunscreen in your 20s, you're probably a little bit late,
Yes.
honestly. I mean, we
Yes.
always talk about sun exposure and what
As
you
a kid.
accumulate, yeah, by the time you're in your 20s. So if you aren't on it, do it now.
Yes.
It's the one thing you'll do every single day, and then it's just easy. So,
Yep. Yeah, absolutely. And that's when you want to really use quality products too. So,
yeah,
sometimes you see people that are using things that may sound great, but may not be the best things to actually put on their skin.
I agree.
And medical grade at that point, when you have a job and you can afford it,
Yeah.
that's an investment that's worth it.
Yeah. Tell me about like as we move into our 40s, what are your patients noticing about themselves?
I mean, most of, I would say that's probably the biggest portion of my patients is like women in their 40s who've probably just finished having kids. And that is head to toe, a transformation on the body with those hormone changes, the weight changes. Honestly, the stress and the selflessness that is a part of that generation, it takes a toll on women's bodies. And even if they're doing their best with eating healthy and getting back to their goal weight and they're going to the gym and figuring out how to juggle all those things, everything is still different. And so you can only do so much with your lifestyle. And I see that as frustrating for women.
Yeah.
They want to do it. They're selfless. They love their families and they would have it no other way. But they're at like this crossroads where they really need some help and they're ready. And so, the most common things we're doing at that age is mommy makeovers. Everyone's breasts are different. Sometimes they would like them bigger, smaller, lifted, whatever. And bellies are just forever changed by babies, no matter what your weight. And so, we're repairing muscles, removing extra skin, contouring because hormones cause little pockets of fat where we've never had them before. They just appear and then they don't go away. And that's just how hormones work. And so it's personalized. Everyone's body is affected differently in that stage of their life. And what bothers them is different. Some people are really comfortable with some parts, but want other parts corrected. So it's definitely a personalized approach. And, at the end of it, you see them gain that confidence back and they find themselves again because I think we get lost in it for a little bit. We're just giving, giving, giving. And then it's like okay to receive and to have that confidence restored
Yeah.
and show up as yourself again for your family.
It feels like almost sometimes like a haze of that like
It
rush,
is.
Yeah,
Yeah,
you
it's
like
chaotic.
yeah, you come out of it and patients are like, "Whoa, I don't think I started this decade, like
Yeah.
this or even a couple years ago."
Yeah.
Yeah, I think my patients are starting to notice early signs of aging.
Yeah.
It's I do some lower lid surgery, for example, on patients who have a genetic predisposition. I think the support of the lid and the fat of the lower lid is just different than an average person, and they show up like, maybe in their 30s. But
Yeah.
I think a lot of times you're starting to see a little bit of that. You're seeing a little bit of laxity in the neck. Can't tell you how many people are coming there like, I just want a little lift. And you can see it when there's early signs of like jowling, descent, like
Yes.
just everything shifts just like
Just a
a
little.
hair
Yes.
down, but it's enough that you notice it. And I think the thing about it is when that happens, it changes the countenance just a little bit. It makes it seem like all of a sudden it's a little tired, it's a little
Yeah.
angry. I think that once that happens, patients start not recognizing themselves. So a lot of times patients will come in and we'll talk about certain things that can be done. I do think energy treatments are appropriate for some patients,
Yeah.
when you go and try to lift and tighten to a certain extent. I think that, volume corrections can be beneficial for patients when they need to kind of add volume to kind of give the illusion of a contour, and that's
Yeah.
what it is. It's the building of that contour that makes it appear more elevated. The one thing though is I do have patients, and this is the really hard part of like, when do you go through surgery? When do you have those
Yes. Yeah.
conversations? And it's interesting because I will often tell patients, I am finding that sometimes I'm talking to my like littler, maybe thinner patients for surgical intervention a little bit earlier.
Hmm.
And the reason why I tell them that is, look, I can do certain things with fillers and non-surgicals, but I think that in the end, you start detracting for what makes that person like beautiful. Like,
Yes.
what is their essence? What is like the thing that makes them special? And I think when you take somebody who has like a really little body, little face, and then make them a little too full, a little too
Yeah.
round, I think you lose contours. I think you
Yeah.
lose definition, and then you're looking at like just kind of, it was the filler fatigue thing, And so, we've always been very judicious about it. And, some people are a little bit sad when I tell them we've come to the end of the road, that, this can't offer
Yeah.
what we want it to offer. But I think there's so much, so grateful that they actually have, I think, a little guidance, and they can make the decision if
Yeah.
it's right for them.
And once they've built that relationship
Yeah.
with you, they've been coming in their 20s and 30s and doing the maintenance and doing the preventative, that when you get to a point where the next decision is more invasive, you've already built that whole relationship and been on that journey with the
Yeah.
patient. And then they're ready to take that next step with you.
The other thing too is I think people are a little bit like kind of taken aback at first sometimes when I bring up surgery and they're not expecting it. But I will tell you, they're never happier when they can get to
Yes.
the goal of what they're trying to get to
Yeah.
quicker.
Yeah.
And that's also something that you want to talk about patients. Like, what are you looking for? What is right in your time for? How can I get you there the most like safe but efficacious way? And I think doing that is very, very exciting for patients when they're finally like, oh, that's the fix. Yeah.
How about that next generation? So we're kind of in that like preventative, very early surgical phase, but then how about that
Yeah.
next generation where, there's true facial aging at
Yeah.
descent, and usually those patients are like, they know,
Yeah.
right?
So this is where I think I see the biggest change. I know you see it kind of in the
A little
yeah,
earlier,
a little
yeah.
bit earlier, but I think I see it right around late 40s into 50s. And I think that's when we start seeing things with menopause, hormone changes. I think photo aging starts taking its toll for a lot of patients, despite how vigilant you've been. I think that the quality of the tissues are just not the same
Yeah.
as you affected estrogen, progesterone levels. And so that's when patients will sometimes call in a panic and they're like, I feel like my face is changing by the week.
Rapidly.
Yeah,
Yeah.
yeah. It's
Yeah.
pretty upsetting for patients. And I think that what I have found is there's a lot in terms of patients when you think about, you know, as we have like in this time, I really feel that I see so many women at like the peak of their like lives and their
Mhm.
careers. There is like a self like self-realization that like a lot of them are pretty happy where they
Yeah.
are, what they've accomplished, where they're going, what they've done, all those things. And I think that when you look in the mirror and it just looks
Yeah.
like maybe you don't recognize yourself, but you recognize like your mother, your grandmother
Yeah.
earlier than you want to. I hear that a lot. It's just like that's not who
Yeah.
it's that disconnect and then the realignment that you can get with a little bit of help.
I love that.
Yeah.
Because they're really achieving that pinnacle in their personal, professional life, and they want to look the way they imagine themselves to look at that moment.
Yeah.
That's kind of everything.
Yeah, I think it's important.
Yeah, I mean, I definitely see that those skin changes that you're seeing in the face are definitely happening in the body as well. I don't know that women are as concerned with it at that generation, because they're not at a point where they are showing their body in the same way that they did when they were younger. And there is sort of like a peace with that.
Mhm.
But I definitely see the women who were able to diet and work out like crazy after their kids, and they were able to like maintain it and maintain it. And then menopause just flips a switch, and then all of a sudden they lose control, and everything that has worked for them in their life to keep their body a certain way,
Mhm.
all of a sudden stops working, and it
Yeah.
makes no sense. And they are so frustrated. And I think that they just want to feel like themselves again. And so that loss of control at menopause is definitely a little subset that I see.
Yeah. It's like
And
what you put in doesn't get out what you
yeah, it just
have.
doesn't
Yeah.
make sense.
The equation doesn't work anymore.
Yeah,
Yeah.
if you've been doing something your whole life and then it stops working, I mean, it's incredibly frustrating. And so we definitely see those like fitter, healthier patients who are coming in at menopause and be like, what happened? Like I could do this for so long. And so, body contouring at that stage is great, but the skin is different. And so the results that you're going to get in the body, because that collagen is different, because those hormones are different, it's just it is a different expectation.
Yeah.
But they're very comfortable with that because they just want to feel good in their clothes. They want to put on their business attire and everything to fit good and to stop thinking about, how uncomfortable they are, how they had a flat belly for decades and like now they're gaining weight around their belly. I think that they have great expectations, as a group, and they're usually fit and healthy, and so they do really well with surgery at that age.
Yeah. So you're talking about like 50s,
Yeah,
60s as we move there.
yeah,
Are you seeing patients in the 70s and 80s?
yeah,
Yeah.
I do,
Me too.
and usually, it's honestly more common than you think, and you would think like, who's really thinking about their body at that age, but they are, and they're fit and healthy, and they've had plastic surgery at a younger age on their body, and they just want things kind of tweaked.
Mhm.
Like they feel great, they look great, and they're like, why not? And as long as they're healthy, medically, there's really not a reason not to operate on people in those decades. So definitely not as common as the younger ages, but I see it more and more as people are just taking care of themselves and they're healthy and they wanna look their best, and they're not throwing in the towel, like, they deserve that, so we definitely see it.
Yeah, I think that for my patient subset, I think that it's almost been an expansion of the bell curve, you know? I
Yeah.
think I'm seeing a little bit earlier and I'm seeing a little bit later in people's lives. And I think the same thing that it really comes to like overall medical fitness. Of course, expectation, things like that. I do think that as you move in those later years, I worry about wound healing a little bit differently.
Yeah.
So that's where medical fitness, it's not just, is your heart healthy enough and your overall, all your medical systems, like, is your body fit enough to undergo the stress of a surgery? Because it is a stressor, it's a
Yeah.
physiologic stressor. But it's like, how do you heal from that? And
Yeah.
I play also with that timeline of healing and recovery.
Mhm.
That's probably the biggest concern for my patients. How long is this going to take to bounce back from when can I get back in my life? And so I think when you're a little bit older,
It's
sometimes it
harder.
takes a little bit
Yeah.
more. So it's something to think about.
I hear that also from patients who had plastic surgery when they
Mhm.
had their kids, and then here they are in their 60s, 70s, and even older, touching something up, revising something, and they're like, this was a lot harder than I remember. But you're just older, and it takes your body a little bit longer to have that bounce back. And
Mhm.
you just have to give yourself the grace, and you have the space and
Yeah.
the comfort in your life at that stage to slow down a little bit. And that's what they have to do. They
Yeah.
just have to slow down a little bit, have more realistic expectations. It's going to look different
Mhm.
at every generation. But it doesn't mean if you're not healthy and, we don't see that there's a need that you can't move forward with it. It's just a little bit of different
Yeah.
expectation.
I agree.
I think our beauty standards are changing, and I love it. I think that we are definitely seeing patients who are more interested in a natural aesthetic. We're
Yeah.
seeing that. I mean, I think breast size is a great example of that. We've moved from these big, very like fake looking breast implants into people who want to almost have no one notice that
Mhm.
they've had a breast augmentation. And that's not everyone, but I do see a trend, at least on the body side, from a very obvious animated
Mhm.
caricature sort of aesthetic to I just want to look like the best version of me. Are you seeing that in facial surgery as well?
Yeah, you know what? I think it happened when I had patients stop bringing pictures of celebrities.
Yeah.
I just don't find like, I mean, maybe somebody will mention somebody, but it's not like I want this nose
Yes.
or this face. Or I think that maybe it's the type of patients we attract to,
Yeah.
Ashley, but I find that my patients are looking like themselves,
Yes.
but the best.
Yes.
Like, a lot of times patients, I don't mind that I'm 50s and 60s. I would just like to look the best I can at
Yeah.
50 and 60. So I think that, this is part of the counseling part of things that I kind of talk to my patients, especially my younger one. I can think of a lot off the top of my head. They'll like a certain look, a certain lip, a certain,
Yeah.
and I'll say, I think that looks great on that person. I
Yeah.
think that works for that person. Do you think you'll like this in 20 years?
Yeah.
Especially when we're talking about things that are permanent,
Yeah.
and like there's some thought that we got to put in this. But the nice thing is I will tell patients, you can have fun with some of the non-surgical side of
Yeah.
it. We can kind of have fun with certain parts of aesthetics, but foundationally, you want to do something that is sound. You want to do something that I find is universally benefit. I think this is the fun part I have with patients too, is that we get to pick what that means for you in a
Yeah.
sense. So like not everybody gets the same kind of formulaic
Absolutely.
kind of process, and so that has been a really great time for me to get to know patients and to know what they want to achieve and design that together.
Yeah. It's fun to look at everyone as an individual, make them a part of that process, and to stop going towards a certain goal and to just improving what we have in front of us. And I think it's been a great cultural shift. And I think it's going to just continue because I think people are seeing, plastic surgery is accessible. They're seeing before and afters, they're seeing the variety. It's not, they don't just have a celebrity to look up to because everyday people are having these sorts of things and they're able to really see the transformations on people's social and web pages. And I think that helps just the average person understand what's attainable and what is going to work for them. And I think they're identifying themselves in
Yeah.
the results of others instead of idealizing them.
Yeah, I think that's a really good point. Very big differentiation there,
Yes.
though. I think it's also one of the things that surprised me about aesthetic surgery. I was not sure when I first started this what it'd be like, what my relationship with patients would be like. And what I mean by that is, certain medical conditions, you see your doctor, and cardiologist, you see them,
Yeah.
throughout your life once you kind of get one. And I didn't know if I was going to have that, which I think is a valuable part of my practice. I appreciate that professionally. I have been just surprised over and over how you really do take care of patients throughout their lives in this really amazing way. But I think it's because we do keep their overall like aesthetic goals in a very kind of natural, attainable way that makes sense throughout the various
Yes.
kind of decades of
It
their life.
evolves.
Dr. Quatella has demonstrated that, in his career, and it really is like this kind of understanding beauty for that person's life.
Yeah. And now that we've been in practice and we're mid-career, you see the longevity of these people and their lives change and their needs change and they keep coming back.
Yeah. So Ashley, we got a lot of patients, like mutual patients that have
Yes.
seen us both. How do you advise how they should proceed? If they have kind of big plans, they want to do a little bit with me, they want to do a little bit with you. What do they do first?
I mean, I think it depends on what bothers them most. I mean, there is no right answer. There's no formula of A, then B, then C. Everyone is different. Sometimes I'm almost surprised by what bothers somebody more than something else, but that is deeply personal. And so you never want to do something because someone else told you to do it. You want to do it when you're ready because, you're investing in that. And so I think that sequence is different for every patient that we share. And then you probably also want to think about the circumstances in your life, the ages of your kids, where you are at your career, because recovery takes time. And so that goes into, I think, the sequential planning of how that all works. And again, that looks different in everyone's world as well.
Yeah, I think it is. I kind of throw that question back at patients and say,
Yes.
"Well,
What
what
do
do
you
you
yeah,
what do you
what do you
notice
wanna
saying? Yeah,
do?
what do
Yeah.
you want to do?" Because it doesn't matter sometimes what I see and what I advise. If
Yeah.
it doesn't bother you, it's not gonna be meaningful.
Yeah.
So that's where you're gonna find the real value of the surgery.
I like when they tell me that too. Like, I'm like, "Okay, we could do a little bit of this here," and they're like, "That doesn't bother me." Great.
Yeah,
Yeah.
perfect.
Right. We're not gonna talk about it anymore. We're gonna move on to some of the other things that you brought up, and then sometimes they circle back to something
Mhm.
totally different. So I think it's deeply personal, and you and I definitely have patients who do have surgery, sometimes close, and we'll just talk to one another, talk to the patients
Yeah.
about what that timeline looks like. How quickly can we do those things in succession? And we always do that in a very coordinated way
Mhm.
because we want you to totally heal from one thing
Yeah.
and be back to normal and to have that area be really well healed and in a really stable place before we move on and find a new surgical site on the body. But that's the beauty of a practice like this because we can talk to each other, we can coordinate all of that. I think the patients feel that too. It's not like they're going down the street and has someone who has no
Like a
idea.
checklist or something,
Yeah.
you know?
Yeah.
It's not like that.
It is like a very deeply personal plan and we have that beautiful communication in the practice. And so that patient, we're kind of taking them on that journey, whatever it is that they want to address.
It kind of you capsulize that really beautifully. It really is us as a guide,
Yeah.
as a resource, and I always tell patients they're honestly in charge. I mean, you get to kind of decide
Yeah.
how you want
Yeah.
to proceed. It isn't as dogmatic as you may think.
No, there's nothing prescriptive about it. And again, sometimes, the things that are really important to them are like deeply personal, that other people may, not be bothered by because of their lifestyle or their profession or, a lot of this stuff is functional too. And so the way that it affects them in their lives is really different than the way that shows up for someone else.
I think the partnering and that discussion that we have patients really saves us a lot of heartache on the back end,
Yeah.
both for ourselves and for the patient. And what I mean by that is patients will always say, "Is it time for me? Is it
Yeah.
time for my face? Is this when I'm supposed to do it?"
Yeah.
And really, I always tell patients you have to make sure that there is something surgically that is appropriate to be dressed. You gotta make sure that you are medically sound and
Yeah.
fit to
Yeah.
have the surgery. But really, then it's like you have to do a little introspection and decide if this is the right time for you.
Yeah.
I think that has guided me very, very well so that I don't want anybody to ever regret something that they've done with me.
Yeah.
And sometimes that means taking a little more time to figuring out if it's right or
Yeah.
not.
And sometimes saying no.
Yeah.
I mean, I love to operate. I mean, we're surgeons. We love to operate. That's like our happy place, right? So and if I have to tell a patient that no, you're not a candidate for this or this isn't going to achieve your goals, it's not because I don't want to operate. It's because that is not the right decision for you right now. It may be forever, but sometimes that's difficult news to tell, but
Mhm.
I think it's really important. And then I always tell them someone out there is probably going to take your money and do whatever you say, but I don't think that's what you want. We're consultants. We're here to help you and guide you, and we're going to tell you the right thing, not because it's right for us, because it's right for you. And that, hopefully we've built such trust throughout our lifetime with these patients that they understand that and they honor that. And I think that keeps us from making mistakes and from getting to a point where people have regret. We just don't see that. But I
I
think
don't think we
we are
can.
so careful about, those decisions and those recommendations that we're always making sure we're doing the right thing at the right time. And I think that's why we have really, really satisfied patients.
Yeah, I've had, life is full of upside downs and as we approach surgery, things happen. And a lot of times I'll tell patients, like, this doesn't feel like the right time right
Yeah.
now.
Yeah.
I think that we can do this, but, whether it is because your diabetes is a
Yeah.
little bit like I'm worried about this, or that you've had a major physical or a mental stressor, emotional stressor in your life.
Yeah.
Like, you got to think about all those things so that in the end, this is really successful and what you wanted it to be.
Yeah. I would say instead of seeing like regret that patients did something that they didn't want to do, I sometimes see patients that say, I wish
Which
I
I done
found you
this earlier.
sooner.
Yeah.
I mean, I think that's one of the most common things I see, especially it is like pretty much every patient with a breast lift and a breast reduction. They're like,
Where have you been all my life?
Yeah, it's just it is so much easier of a surgery than people think. And so they play it up in their head for years and years and years. And then it's just like a little blip and they're done and they love it. And when things have a quick recovery like that, you probably see it for blephs. When they have that quick recovery, it's like, why was I waiting to do this? It's so satisfying and it fit into my life so easily.
Yeah.
Is there one surgery for you?
I think there's like different surgeries for different patients. Like I can't tell you how many rhinoplasty patients wish
Yeah,
they had
that's
done it
true.
earlier.
Yeah.
I think necks and jawlines.
Yeah.
I find that my patients who are a little bit older wish they had done it. I have
Yeah.
patients send their daughters
Oh, I
because
love
they
that.
see a little
Yeah.
bit of that genetic neck, that genetic predisposition. So that's been really exciting, and it's fun to see, just people feel their best.
Yeah. That mother-daughter thing is interesting, right? I definitely see that for breast too, like moms who've had breast surgery as a younger person feel and understand that transformation and that confidence. And when their daughter, is also large breasted or has whatever, kind of genetic tendencies that they did,
Yeah.
they are so willing to bring them in and help them find that confidence because they really understand it.
Yeah, it's the understanding. When I'm sitting there and kind of we're morphing photos of a rhinoplasty, I always say that I have to wait for a little sparkle in the patient's eye.
Yeah.
It should be an emotional response to this
Mhm.
new nose that
Mhm.
will kind of anchor and carry their face. And it's interesting when we have parents there, you can see their emotion for a
Yeah.
couple reasons because they know what some of that felt like if they've
Mhm.
felt some of those feelings before, and also just to see your child
Mhm.
shed something.
Yeah.
I just had a patient who said that her mom said she covers her face when she smiles because she didn't want, like, could you imagine that? A beautiful
Yeah.
girl with a beautiful smile. So just like some of those things, like it gives me chills just thinking about. But those are really great things, and I think that the time is right when I always tell patients the time is right when you came and decided to walk through the door.
Yeah.
There's a lot of things that patients have to kind of come to terms
Yeah.
with before they
To
make
make
some of
that
those
step.
decisions, to
Yeah.
do the research, all those sorts of things. So I say, don't beat yourself up. We'll just do what's right from here on out.
Mhm. I think in what we do, there is always a role for surgical and non-surgical. And I don't think that there's, again, a prescriptive map of what that looks like. I think that they kind of all connect. And so I think, that your aesthetic road is kind of peppered with all of these things, in concert. And I think we can do some non-surgical, some preventative type things. And then we do get to a point where we're at a crossroads and it makes more sense to do something surgical and to invest in something that's more permanent. And I see that in like both our worlds. In the body world, what can we do non-invasive? When does that switch happen? And certainly in face with injectables, there's almost even more there, on your end.
It's interesting because I think everybody thinks a non-surgical is when you're young. And I do think there's more opportunities for that. But I do have patients who are interested in some of the non-surgical modalities even later in their life.
Yeah.
I think the whole point is they should be complementary.
Yeah.
So sometimes, we are looking for things that, will build collagen, volumize, all those sorts of things. And we're able to do those, judiciously at various points. Sometimes patients say, well, I've done my lift. I'm done with everything. And I'm like, well,
No.
you could be.
Yeah.
But if you want to look at this a little bit more kind of um, comprehensively, age doesn't, we didn't stop aging
Yes.
after our surgery. So there are some things that we can still do to maintain, to optimize our results so that we can enjoy them longer.
Yeah. We're just resetting the clock. We're kind of just
Mhm.
like turning back time and getting you to a new starting point, but your skin and your tissue is still aging and changing. And, there's still gravity on this planet that is, something that we can't control and is going to continue to change you. We've just set the clock back. And
I always
so,
tell patients that moving sidewalk, it still goes.
yeah.
The rate per person is different. You just
Yes.
pick you up and put you back a
You just
little bit. Yeah.
turn it
Yeah.
turn it back a little bit. I love that analogy, actually. That's a super cute visual. But Yeah, so it's not done if you don't want it to be done. There's still things that we can do so that we kind of slow that aging process every step of the way. And then we just see how you do. And eventually we're going to get to a point where you might want to come back and move to the beginning of that evergreen sidewalk again. And that's different for everyone and that looks different for everyone. But there is absolutely certainly things that we can do, energy based treatments and, skin maintenance type treatments in between all those surgical procedures that, will help you maintain beautiful results.
Yeah, so for example, like Emsella is
Yeah.
exciting, but it doesn't give you everything that a surgery would give you.
Yeah, like I think that you can do some fat reduction, you can do some tightening of your muscles with something like M Sculpt, but it is not surgery and it is not going to change your anatomic physiology of your muscles. Only surgery can do that. But can it tighten things and maybe kick the can down the road a little bit to give you a little bit of more of a timeline until you have to do that or let your kids get a little older so that you're ready for recovery? Absolutely.
Yeah.
Absolutely.
When I think about filler, typically fillers come in around a 1 cc syringe, it's like a teaspoon. I always tell patients this is not fixing anything.
Yeah.
So that's the difference that of a non-surgical, like a
Yeah.
filler versus something like a surgery, that I find that it's amazing what you can do with that syringe.
Yeah.
But it is something that I'm really using. There's no better way to say it, but it's a camouflaging. It's building and
Yes.
camouflaging. There's not a lot that's actually lifted. It gives
Yeah.
the illusion of the lift. And so once I clarify that with patients, I think the expectation is understood a little
Yeah.
bit better.
It's not gonna fix everything. It's
Not
not
fix
a magic
everything.
eraser.
Wish.
And I say that a lot. And certainly surgery is not either, but it's anatomic, it's precision. It is really anatomy focused and restorative in a way that nothing else can do.
I always tell patients that anatomy, because especially with facial rejuvenation surgeries, I will look at photos. I'll have them send photos of when they were younger. But
Yeah.
really, when I'm in surgery, a lot of times, I don't know some of these patients for years and years. I didn't know them 30 years ago.
Mhm.
And so what it really comes down to is, where do I know where that line is,
Yeah.
to lift to, or to where is that aesthetic endpoint? And it really is the anatomy.
Yeah, it's where it
Because
should
when you
be.
elevate that just right, all those aging concerns that have kind of accumulated and compounded are alleviated in
Yeah.
this really great way.
And you just know.
Mhm.
So we love taking care of female patients. I mean, we love taking care of all patients, but as women, I think we really connect with women at every stage, and then we also see what's ahead of us and where those patients are coming from. And I think that there's no right point to start your relationship with a plastic surgeon. It's whenever you're starting to think about those things or you want to be as preventative as possible, that's the right time. And I think that there's something that we can talk about and address and really just plan for the future. And so at any time point, I think when it's crossing your mind and you're kind of curious about what your future has to offer, the more and the earlier we see you, the more we can build that relationship and kind of go on that aesthetic journey with you and for you.
Yeah, when we talk about what social media has done, it has opened up so many amazing
Yeah.
avenues. But I think the downside is it can be very misleading and confusing for patients. It really comes down to when you want to talk about it,
Yeah.
when you want to talk about how it pertains to you,
Mhm.
and coming in to partner with somebody who has, I think, really dedicated their lives to understanding aesthetics and how to get somebody where they need to be through this really incredible, occupation or the skill of plastic surgery. It really does open up so many great avenues for patients, and it's been a lot of fun from our end for
Yeah.
sure.
I mean, you don't need to know what you need and when you need it. You don't need to make that roadmap. That's what we're here for.
Find
So
somebody you
yeah.
trust. Yeah.
Yeah, don't stress about, and deep dive research a procedure. I mean, you certainly can, but don't feel like you need to come in with all the answers. It's a relationship and we'll build that and we'll kind of help you every step of the way and it's going to look deeply personal for every
I think
patient.
that's the empowering part. Like, we get to do something and we get to do it together.